All right, guys, we are going to talk about sexual difficulties and solutions today. One of the things that we want with sex, of course, is to be sexually satisfied, and this is one of the main reasons for people entering therapy. If, of course, the other outcome of having sex is having a baby, but usually people are not going to a therapist. If they are having baby making issues, they go to a doctor. So, the psychological aspect of sexual disorders is sexual satisfaction. This is, of course, a subjective component. And hopefully, in a healthy relationship, you are wanting mutual pleasure. So he's happy, she's happy, everybody's happy. Um, One issue is sometimes that only one part of the couple is happy, sometimes both are unhappy. So, sexual problems are actually pretty common, but they run a huge gamut of various issues. So, it could be lack of interest, lack of arousal, lack of orgasm, and it may or may not cause distress. However, if it's not causing distress, we don't usually classify it as a disorder. So, sexual disorder, for it to be classified as a disorder, it causes a great deal of psychological distress to the individuals who are troubled by them as well as their partner. And sometimes you have a couple disorder. But we're just going to talk about individual disorders here, although certainly don't forget that it is going to affect the entire couple, as well as being associated with overall well-being and life satisfaction. So this is some recent research about how physically pleasurable the relationship is. You can see men are extremely or very satisfied, significantly more than women are, although it's not a huge difference. And women tend to be in the slightly or not at all regarding how pleasurable it is. So about 5% higher in not having any pleasure. Also, research shows about 21% of women experience pain in sex. So that's an unfortunate thing. But we'll talk more about pain during sex. So it's not just whether you enjoy it or not, whether it's pleasurable or not, but also is there pain. And sometimes there's both pain and pleasure, which may or may not be a good thing depending on what you're into. So this is the prevalence of sexual problems by demographic, so age and education, as well as gender. So lack of interest entirely in sex. Ages 18 to 29, 32% of women lack interest in sex, and 14% of men. Interestingly, it's not a huge difference, but as women get older, their lack of interest in sex actually decreases, whereas men's increases. So women have more interest in sex as they get older, and men have less interest in sex as they get older. Hollywood portrays that as opposite, and that's not true. Okay? Women actually become more interested in sex as they get older, and men lose some interest in sex. It's not huge for either, but it's enough that I have noticed it doing couples therapy. And then education. If you are a high school graduate or college graduate as a woman, your interest in sex increases or lack of interest decreases. It's kind of like a double negative, so it's a little confusing. But as the percentage number goes down, that actually is indicating more interest in sex. So more educated you are, the more interested you are in sex. And for men, the same thing is happening, although you do see a little bit of it's probably not statistically significant, so I wouldn't even say anything about that. But certainly going from less than high school to a high school or college education increases sex or decreases lack of interest in sex. All right, can't achieve orgasm. Younger women have a harder time achieving orgasm, and we'll talk about some reasons why. 30 to 39 years old, that lack of orgasm peaks, and then it actually decreases. Okay, so meaning that this is, again, an opposite one. It's not really worded very well, but I didn't do the study. So as women get older, they're better able to have an orgasm. Men have the opposite issue, which might also be why they start to decrease their interest in sex. Then erectile dysfunction in men, that is also getting to be a bigger problem. The percentage increases as men get older. Pain during sex for women decreases as they get older. okay, which is also probably one reason why they can achieve orgasm better and they have more interest in sex. So like I said, 21% of women have pain during sex, but that does decrease as women get older. And then climaxing too early, this is a male problem. Well, it's classified as a male problem, but it can be a female problem too, but you'll never hear anybody talking about that. So that doesn't really change over the lifespan. Yeah, there's some variation, but it's not probably not statistically significant. And then you see similar things going on in education. So as women are more educated, they're better able to have orgasms. As men are better educated, they are also more likely to have orgasm. So the number's decreasing because it cannot achieve orgasm. Erectile dysfunction doesn't really change, maybe decreases a little bit, but it's not huge. Pain during sex also decreases with education. And climaxing too early. Now that is a significant difference, 38 to 27%. So college-educated men are able to climax at a more appropriate time. All right, so that's kind of interesting. Age and education, as well as many other factors, affect our sexuality. So there are specific problems at specific time points in sex. A sexual disorder, to define it, is a problem with sexual response that causes a person mental distress. Okay? A problem with sexual response that causes a person mental distress. But it is a bit more than that. We usually think of response as sex has been initiated and then there's some issue responding to it. But there can be issues with even getting interested in sex. So that is a desire phase issue. There's problems getting aroused. That's an excitement stage. And there's problems with orgasm. Maybe you don't have an orgasm or you orgasm too early. So that is the orgasm stage. Pain during intercourse, we've talked a little bit about that. That can happen at any of the stages for men or women, but it's much more often a female issue. Sexual difficulties can be lifelong or acquired. A lifelong sexual disorder is one that has been present ever since the person became sexual. So not necessarily from birth, but from the first sexual activities, which may or may not include actual sex, penetrative sex. And then an acquired sexual disorder is a dysfunction that develops after a period of normal functioning. So things are going fine and then something happens. Like for instance, maybe you were raped. So before being raped, everything was great with sex, and then after being raped, now you have difficulty getting interested in sex. And then it can be generalized or situational. So maybe you have a hard time getting interested in sex with any partner that you've ever had, or maybe it's one specific partner who maybe reminds you of the rapist or something like that. Okay. So let's talk about desire phase difficulty. So desire disorders include hypoactive sexual desire, as well as discrepancy of sexual desire. So when sexual desire is very low, so that the individual is not interested in sexual activity at all, or very little interest, the disorder is referred to as hypoactive sexual desire. Hypo means low or below, and then active is the activity of sexual desire. So it's low sexual desire. The DSM-5, which is like the diagnostic manual, has changed the terminology to a separate diagnosis for males and females. So the female version was merged with female arousal disorder to become female sexual interest/arousal disorder. With discrepancy of sexual desire, the two partners have considerably different levels of sexual desire. Now, this is not an official disorder, but this is an issue that if you were a couples or a sex therapist, or possibly just married, you may come across this. Now, let me go back to this chart, because again, remember, women, as they're getting older, have more interest in sex. Men, as they get older, have less interest in sex. Women have less issues as they get older. Men have more issues as they get older. So there could easily be an issue of discrepancy of sexual desire, and this is very normal, and it's just something that has to be worked out between the couple. Whereas a lot of couples feel shame, or they shame each other, and that is a shame because it's such a normal thing, and you just have to work out how to handle it. Then you can also have sexual aversion, where you have negative feelings regarding sex. You are averse to sex. So you feel fear, you feel discomfort, you feel disgusted by it. That's something that you usually hear from women more than men, because women's sexuality is shamed in westernized culture. Not as much anymore, and we do see less of this than you would have seen a generation or two ago. But yeah, so women often feel like their vagina is disgusting, or the fact that it gets wet, or that it has a unique smell, or things like that are gross. And like if a man wants to look at her or have oral sex or something like that, then many times because they think it's disgusting, they think he's going to think it's disgusting, which is not the case unless you have a guy who's really mentally screwed up. All right, anyhow, then we have, I should also mention arousal disorders include female sexual arousal disorder and male erectile disorder. That is in the arousal disorder category. So female sexual arousal disorder is a lack of response to sexual stimulation, including a lack of lubrication. Although I should point out that lack of lubrication is not necessarily a mental disorder. It could happen because of a psychological cause, but it could also happen because your body just decides not to make any lubrication that time. And it's just a totally normal thing where you can be extremely turned on and you just don't make anything. You don't make any lubrication. And then sometimes your partner will think that you're not interested because you're not making lubrication, and that's not necessarily the case. And also, women can make lubrication when they aren't sexually aroused. That's totally possible too. So many women who are raped or molested will report that their body produced lubrication, and so they're really mentally just kind of screwed up's not the right word, but it's the word I'll use. So you're kind of screwed up over this, where why would I be aroused by being raped, or why would I be aroused by being molested? And you weren't necessarily. Just because you made lubrication does not mean that you are actually aroused. It's sort of like a reflexive response, and it's not a perfect response. It can respond to a lot of different stimuli. So your body knows, and I personally, my theory is, and I don't know that, I have never seen any research backing this up, but it's just my personal untested theory, that our body was designed to produce lubrication at any sign of sexuality, because sex without lubrication is extremely painful and can cause a lot of damage, including infertility is possible. So at the drop of a hat, your vagina can start producing lubrication, even if you aren't interested. On the other hand, our body sometimes doesn't make the right responses, so even if you are interested, you may not produce lubrication. Also, there can be hormonal issues. You can be low in estrogen, so a lot of women who are menopausal won't make lubrication even though they are aroused. Okay, so long story short, lack of lubrication does not 100% of the time mean that you have an arousal disorder. Okay, anyhow, I was trying to bring up male erectile disorder, no pun intended, and now I'm just talking about women. But erectile disorder is the inability to have an erection or to maintain an erection. Okay, so that is also in an arousal disorder because it is in the desire phase. Then we have excitement phase difficulties, which are... I'm sorry. Okay, that whole time I was talking about arousal disorders, and that is the excitement phase. So, sorry if I confused you here. Okay, let me go over this one more time. You might have to rewind this and re-listen to it. Okay, we have desire phase. This is the getting interested in sex. So we have hypoactive sexual desire. You have low sexual interest. Desire discrepancy, where there's different levels of interest, of desire. And then sexual aversion, where you are averse to sex, and so obviously desire phase. Now then I started talking about the arousal disorders. This is excitement phase difficulties, or arousal phase difficulties. Okay, so again, that's female sexual arousal disorder, male erectile disorder, And also, I don't think I mentioned this, persistent sexual arousal disorder, which is where you get overly aroused. So spontaneous, intrusive, and unwanted genital arousal in the absence of sexual interest, which is, well, I think it's a really interesting disorder, but you can watch like a video on YouTube. There's a lot of documentaries about it, like a woman who has 100 orgasms a day. So that would be persistent sexual arousal disorder. Okay, hopefully I didn't confuse you too much. These are 3 different disorders within the excitement phase or the arousal phase. Then we have orgasm phase difficulties. So this includes premature ejaculation, male orgasmic disorder, and female orgasmic disorder. So female orgasmic disorder is the inability of a female to have an orgasm. So it could be the total absence, could be a delay, or a diminished intensity of orgasm despite the fact that she is aroused. She has a high subjective level of arousal. Okay? Subjective meaning it's her opinion, not necessarily how lubricated she is. Then we have female orgasm during intercourse, which you could also call situational orgasmic disorder. So it's a case of orgasmic disorder in which the woman is able to have an orgasm in some situations, but not in others. And that really is more than just intercourse. But so many more women experience orgasm from masturbation, manual stimulation, so with the fingers, and oral sex. And one reason is, and this really should not be a disorder, this is a leftover from Freud, where Freud said if you cannot have a vaginal orgasm, then you are emotionally immature and mentally unstable. And that is just not the case. Most women do not have vaginal orgasms. They have clitoral orgasm. And the clitoris does not always get stimulated during penile sex. Okay. Now it does if you pay attention to that. Okay. You need some bumping and grinding there to get that clitoris stimulated. But the penis just going in and out doesn't touch the clitoris. At least not externally. Internally, there is often pressure on the internal parts of the clitoris. So even when a woman thinks she has a vaginal orgasm, she's probably still having a clitoral orgasm. Okay, so vaginal orgasm is, I don't know if I would say it's a myth, but it's pretty close along the lines of a myth. Okay, so it is not a disorder to have that sort of situational orgasm. Although it can be more than that, the situation could have a big impact psychologically on whether you get interested in sex and can achieve orgasm and so on. Anyhow, then we have various male orgasm disorders. So delayed ejaculation is sometimes called just male orgasmic disorder, and it's the opposite of premature ejaculation. So the man is unable to have an orgasm, or it is greatly delayed, even though he has a solid erection and has had more than adequate stimulation. Whereas, of course, premature ejaculation occurs when a man has an orgasm and ejaculates too soon. So those are 2 opposite disorders. Then we also have, let's see. So faking orgasm, it's not a disorder. It's just something that happens among men and women, although it's much more common among women. But men also sometimes fake orgasm. I've heard a lot of arguments on both sides of it about whether it is good or bad. And I think that's really situational. It depends on your relationship. In general, lying in a relationship is not a good thing. Being honest, I mean, women, you deserve to have an orgasm. So if you're not having an orgasm, then he needs to, both of you, not just him, need to do something about it. Okay, so you should be honest. Now, if you're just really tired and you just want him to be happy and then you want to go to bed, I'm not going to judge you on that. But in general, you should not lie about your orgasm because you should have them. All right, anyway, I'm just going to move right along with that. So this is the percentage of have you ever faked an orgasm. 60% of heterosexual and 71% of lesbian women say yes, they have faked an orgasm. Men, it's much lower, 17% of heterosexual men and 27% of gay or bisexual. So it's generally a female issue, but it's not just females. All right, so let's talk about pain. Pain disorders include painful intercourse and vaginismus. So painful intercourse is also called dyspareunia, and it refers to genital pain experienced during intercourse. Do I have vaginismus? Okay, yeah, we'll get to that next. So it's experienced by men and women, but it's much more common in women. Dyspareunia, or painful intercourse in men, is often caused by physical issues such as infected or irritated foreskin, pelvic infections, etc. Dyspareunia in women is can also be caused by infections, can cause by endometriosis, which is where the uterine lining grows outside of the uterus. It can be very painful. Inadequate lubrication is a very common one, and also pelvic pain penetration disorder, which could be physical or mental. Okay. Vaginismus is often confused with dyspareunia, but really it's a spastic contraction of the outer third of the vagina. So the vaginal canal is it's a muscle, and like any muscle, you can clench it voluntarily, but also sometimes your mind just forces your muscles to clench. Like if you think you're about to get hit, your mind will make all your muscles bunch up to protect you from the pain. Because the more bunched the muscles are, the more protected the rest of your body is. And so the vaginal canal can do the same thing. So it is usually caused by anxiety, usually preceded by a history of painful intercourse, dyspareunia. So they're very much connected. Also could be rape or molestation or something. If it causes anxiety, it can cause that specific muscle to contract. Now, we treat it with contraction prevention. This can be learned, but women do not consciously will vaginismus to occur, so it can be hard to consciously train them out of it. Okay? And the vagina actually clenches and closes so strongly that you can't have intercourse. You can't even get the penis into the vagina, and it's very painful to try to get the penis in. Okay. Many of these women are situationally orgasmic, so they're sexually responsive and orgasmic with manual or oral stimulation, but the penis entering the vagina, they have difficulty and pain with it. But it is something that can definitely be fixed with therapy. Okay, so it's all about lowering anxiety, making her feel comfortable, dealing with whatever is causing the distress, and then once she's not feeling distressed, her brain won't tell her vaginal muscles to contract, and then it can work. But it's something you have to be really patient with. All right, so what causes sexual disorders? We have physiological or physical factors that can cause sexual disorders, including organic factors such as like diseases or injuries. Drugs can cause it. Any kind of vascular pathology, which is problems in the blood vessel, vascular, supplying the penis as well as supplying the clitoris, remember they're built the same, can cause erection problems. You could have hypogonadism, which is an underfunctioning of the testes, so that testosterone levels are very low. That's associated with erectile disorder. You can also have low testosterone in women, because both men and women have it, and so that could be related to females' hypoactive sexual arousal. Early ejaculation is more often caused by psychological than physical factors. So some are more physical, some are more psychological. In cases of an acquired disorder, though, in which the man at one time had ejaculatory control but later lost it, physical factors may be involved in that situation. Male orgasmic disorder or delayed ejaculation may be associated with a variety of medical or surgical conditions, such as multiple sclerosis, spinal cord injury, prostate surgery. Those could all be related to it. Female orgasmic disorder could be caused by severe illness, general ill health, could be extreme fatigue, could be stress, could be anxiety about whether you should be having sex. Like if this isn't your husband, this is a one-night stand, you might be having intense anxiety. Women who are virgins or who are novice to sexuality often report not having an orgasm, and it's not really surprising. Okay, so it's not necessarily a disorder. It could be a normal thing, or it could turn into a disorder. Usually when we're looking at disorders, we look at, is there distress? And also, is it something that has been sustained over a period of time? Let's see, dyspareunia in women is often caused by organic factors. So that's painful sex. So organic factors, meaning like disease, injury, physical factors. Vaginismus is sometimes caused by painful intercourse. And I said that before, right? So vaginismus and dyspareunia are connected. So that is often an organic factor, although vaginismus is strongly related with psychological factors as well. But the point is, it could be either. Could be physiological, could be psychological. Do I have psychological on here? Yeah, well, anyhow, I'll just keep talking. Let's see, what else? Some drugs, medications, could have side effects that cause sexual disorder. Alcoholics, particularly in the later stages of alcoholism, frequently have sexual disorders, typically erectile disorder, orgasmic disorder, loss of desire. And that may also be associated with the fact that alcoholism, well, alcohol period, but obviously the more you drink, the worse the problem is, can cause vitamin deficiencies, which could lead to all sorts of health factors. In surveys of users, many respondents report that marijuana increases sexual desire and makes sexual interactions more pleasurable, but there is a lack of scientific research about that, so it's hard to say if that's true or not. Makes you more relaxed, and we know that anxiety prevents a lot of enjoyment of sexuality, so it could be. With regard to potential negative effects, though, there is concern that marijuana use contributes to risky sexual behavior, such as unprotected sex. Again, you're relaxed, so you're not really, it doesn't really seem that big of a deal. However, I will say the research shows that even if it is increasing sexuality, chronic use decreases sexual desire. Chronic use causes all sorts of problems. So there's a difference between whether you have just smoked it once or a couple times, and if you have used it over a number of years. Cocaine is said to increase sexual desire, enhance sensuality, delay orgasm, but again, chronic use of cocaine is associated with loss of sexual desire, orgasmic disorders, erectile disorders, and yeah, it's not it's not really the best enhancement to having sex. And then cocaine is also associated with murdering your partner, so yeah, probably not the best thing. Domestic violence, so on. Most murders and most domestic violence happens under the influence of drugs or alcohol, about 80%. Some psychiatric drugs that are used to treat psychological disorders also affect sexual dysfunctioning. Every aspect of sexual dysfunctioning just depends on the drug. So, again, I don't think I have a slide specifically on psychological factors. I think I kind of broke it up here. So we have cultural influences, negative childhood learning, the sexual double standard of our society, you know, the Madonna whore complex of women. You're a virgin, you're good. You're interested in sex, you're bad. Whereas men, we kind of expect to be more interested in sex. Narrow definitions of sexuality, performance anxiety, your religious background. You know, there's all sorts of, some cultures are much more encouraging of like exploration and doing weird stuff in sex, and others are more like missionary style and that's it. So there's all sorts of cultural influences. And then I guess I'll talk about psychological factors with this. So psychological causes of sexual disorders could be categorized into immediate causes, prior learning, emotional factors, behavioral or lifestyle factors, problems with sexual excitation or inhibition. So immediate causes are things that happen in the act of lovemaking itself that inhibits the sexual response. So that would be like anxiety during a sexual interaction could be a source of sexual disorders, could be caused by fear of failure, fear of being unable to perform. Cognitive interference can be an immediate cause of sexual disorders. It refers to thoughts that distract the person from focusing on the erotic experience. There's something called spectatoring, where the person behaves like a spectator or a judge of their own sexual performance. And I often hear this with women. You know, they're analyzing how their body looks, how their breasts are, you know, appearing because they're laying on their back or whatever. And so they're constantly judging themselves. Failure to communicate is one of the most important immediate causes of sexual disorders. Many people expect their partners to be psychic concerning their own sexual needs. Many expect, like, if you watch porn, you expect it to be like a porno, and that's not how it is, and then you don't talk about it, and so, yeah. talking about it, communicating is super important. Another immediate cause of sexual disorder is a failure to engage in effective sexually stimulating behavior. And often this is just because of simple ignorance. So I don't know why, if you're having sex, you wouldn't be interested in having better sex, but there's all sorts of books out there, and, don't watch pornos in order to learn about sex, because porn is only visually stimulating. It's not actually real life sex. So it's a terrible way to learn about how to have sex. Buy a book or take a course. There's actually classes on it. Talk to a sex therapist. But yeah, don't have crappy sex. Then the things that we have learned earlier in life, like in childhood, for example, can definitely affect our sexual response. In some cases of sexual disorders, the person's first sexual act was traumatic, which is very common if you have sex at a young age. In other cases of sexual disorders, a person grew up in a very strict religious family and was taught that sex is dirty or sinful, or that your body is dirty or sinful. And that happens in many different religions. Emotional difficulties, such as anger and sadness, can interfere with sexual responding. If you're stressed out, especially women, when women are stressed out or when women are angry, then that usually shuts down their sexuality. Whereas men being angry or emotional or stressed out usually increases their sexuality, which is why historically you would see soldiers after war going around and raping women, because all that adrenaline pumping through their blood makes them more sexual. But for women, it shuts them down. So guys, if you want to have sex and your wife is super stressed out and she's like, I have a headache, I'm not interested. Well, try to decrease her stress levels, and then she'll probably be much more interested. Or if she's pissed off at you, then you're not getting sex. But it's not because she's punishing you. She's just not interested. Being angry decreases women's sexual drive. And then, of course, you have that discrepancy of sexual disorder, which can cause issues. Of course, like smoking, alcohol consumption, obesity, they're all associated with higher rates of sexual disorders. If we look, I've mentioned the dual control model before. So it's the excitation inhibition model, where part of your brain makes you more interested in sex, and a different part of your brain stops your interest in sex. And so they can both be working at the same time or at different levels. And again, it's suggesting that there are two basic processes underlying human sexual response. So excitation, responding with arousal to sexual stimuli, and inhibition, which is inhibiting or stopping sexual arousal, not responding to sexual stimuli. So people who are low on excitation or high on inhibition are the most likely to develop sexual disorders, but it kind of depends on which sexual disorder we're talking about. Like a sex addict who's having too much sex or risky sex, they would be high on excitation and low on inhibition. So it just depends on the disorder. There is another cognitive physiological model of sexual functioning and dysfunctioning that suggests that we function well sexually when both partners are physiologically aroused and interpret that arousal as sexual arousal. Because remember, there's all sorts of different types of arousal. Sexual arousal is just one type. So people with sexual disorders tend to interpret arousal as anxiety. So your body's producing all this adrenaline, it's getting aroused, not necessarily sexually aroused, but arousal just means your body has been activated. When you're angry, you're aroused. When you're scared, you're aroused. And so a lot of people with disorders view that arousal as anxiety. Okay, so let's see what else. Problems in the couple's relationship are another leading cause of sexual disorders. Anger or resentment towards your partner obviously doesn't create an optimal environment for sexual enjoyment. Kind of talk about that. So, I've kind of talked about all this in some way or the other. All right, so I guess I'll just talk about therapy in general. I don't want to make this lecture too long because I'm always making lectures really long. So a group of sex therapists specializing in treating women's sex problems formulated a new view of the nature of these problems and their causes. So the view is really critical of the DSM's category of disorders, and they proposed that we should categorize disorder as like sexual problems due to sociocultural, political, or economic factors, sexual problems relating to partner and relationship, sexual problems due to psychological factors, and sexual problems due to medical factors. And I think that would be a helpful categorization of disorders. So the basic assumption of therapy, and usually with sexuality, we're talking about behavioral therapy, although certainly that's not the only type of sex therapy that can be done, but it's probably the most common. So the behavior therapy approach is that sexual problems are the result of prior learning, and that they're maintained by ongoing reinforcements and punishments, which are immediate causes. So you're reinforced to do this behavior in some way. Like, for instance, you have anxiety about sex because you were raped, and then you're having some vaginismus issues where your vaginal canal muscles are contracting, and then your husband gets mad at you over it, and then that creates more anxiety. So, it's reinforced and punished in order to maintain the problem. So it follows that these problem behaviors can be unlearned by new conditioning. You can just teach somebody a new way of sexuality and it would fix the problems, at least the psychological ones, obviously not the medical ones. In one technique, for instance, a couple is assigned what's called sensate focus exercises, and this is where one partner, like for example, caresses the other, and the other one is responsible for communicating what's pleasurable, and there are no performance demands. This is not sex. It's simply do things to each other and tell the partner what is enjoyable. So that's behavioral therapy. Pure behavioral therapy. We also have cognitive behavioral therapy, which I think is a better version, and that's my opinion. The therapist will use like cognitive restructuring to essentially help the client restructure their thought patterns, helping them to become more positive, helping them to work through whatever thoughts they have in their mind, like I look ugly when I'm in this position, or my husband couldn't possibly think my vulva looks pretty or smells pretty or is a turn on. So we have these thoughts as well as behaviors that are influencing our disorders. Mindfulness therapy is another common method of sex therapy. It's also called mindfulness training, and it's a system of training people in mindfulness practices. One goal is to help people regulate their own negative emotions. And so it's basically mindfulness is referring to focusing your attention on experiences in the present moment in a calm, non-judgmental way. So some researchers argue that online sex therapy could be ideal for people. Anonymity would be a major advantage of that. Also, it's hard to get to a therapist sometimes, especially during a pandemic. Couples therapy is another common therapy technique, and it's basically assuming that there's kind of this reciprocal relationship between interpersonal conflict and sex problems, and there's a lot of evidence to support couples therapy. But sometimes therapists will be a couples therapist that does mindfulness or cognitive behavioral or something, so it's not necessarily exclusive. Do I have any of this on here? Not really, but I think this is important, so I'm just going to keep blabbing on. So there are specific techniques, and I think I actually do have some of this. Yeah, okay. So the stop-start technique, for instance, for premature ejaculation, it kind of trains men. You start having sex and then you stop, and it trains them to last longer. The most effective form of therapy for women with primary orgasmic disorder would be a program of what we call directed masturbation. And so they kind of explore their own body and learn what pleasures them without the anxiety of having sex with a man. Kegel exercises help to exercise and strengthen the pubic muscles, or the pubococcygeal muscle, more specifically. And that's, the Kegel muscles are, so this is only for women. When you are on the toilet and you're peeing and then you stop your pee, that's the Kegel muscles that you're using. So squeezing, contracting those muscles will build up like the pubic floor and stuff, and can help with many disorders, but not vaginismus. It's bad for that because what you wanted to learn with vaginismus is to relax those muscles, not to tighten them. So it depends on what we're talking about. And then, of course, we have bibliotherapy where you go read a book. Imagine that. All right. Anyhow, that's my sarcasm for the day. Then we also have medications. I don't know if I have any of that in here. Oh, look, vaginismus, relaxation. Okay, that's what I'm talking about. Do I talk about? Okay, medical, yeah. Viagra, Levita, Cialis, all of those things. Zydina. So there are medications that help with erectile disorder. Viagra being the most popular one. There's also, you can do suction pups, implanted penile prosthesis. There's various things you can do that help with that. And they do work, some better than others. Viagra relaxes the smooth muscles surrounding the arteries to the penis, and so it facilitates engorgement. Cialis lasts longer than Viagra, but Viagra could potentially last for hours, although it's better now than it used to be. But one of the problems with these is that it can cause heart issues, and usually when a young man, like in his 20s or even 30s, ends up in the hospital with a heart attack, you look for the Viagra or whatever sexual functioning drug, Levitra or Cialis. So there are side effects to those. It's potentially an issue, so something you have to be aware of. Okay. They also have these medications for women, but it's not really been shown to work well. Okay. It increases blood flow to the clitoris, but for women, that's not really the biggest factor in sexuality. Men, as long as they can get it up, they can enjoy sex, generally speaking, as a rule of thumb. But for women, getting up your clitoris, it doesn't matter. It's more of a psychological thing for women. Although certainly the psychology is hugely impactful for men too, but it's more impactful for women in that sense. All right, so anyhow, trying to think of what else needs to be said about this. Basically, people could use some of the principles that emerge from a sex therapist's work to avoid having sexual disorders in the first place, and I think that's important to consider. So the primary principles of good sexual mental health would be communicate with your partner. Don't be spectators. Concentrate as much as possible on giving as well as receiving sensual pleasures. And if you don't feel like you can receive, which is often a woman thing, then you need to work on that because it's just as good to give as to receive when it comes to sex. Don't set up goals of sexual performance, like try to lower your expectations. Doesn't mean that you shouldn't expect good sex, but the way you get to good sex could be different depending on the couple. Just like a good relationship, everybody has different relationships, and you need to try to have expectations based on who the individual is that you're in a relationship with, rather than this vision you have in your head of what a relationship should be like. Be choosy about the situations in which you have sex. That could be helpful. So, you want to have sex with your wife in an elevator. She just may not be into that, and that doesn't mean there's anything wrong with her. Or, ladies, you want to have sex with your husband in his mom's house, and that could really screw with his brain. It's just not into that. Consider where you have sex, consider the romantic part of having sex, and consider, like I said, the goals of sexual performance. Consider who that individual is, and that, just because you saw it on a porn doesn't mean that your partner's messed up because they don't want to do that. Like anal sex. A lot of women especially don't want to have anal sex. And, actually, I guess men probably don't want to have anal sex more than women, but a lot of women don't want to have it. So, that doesn't mean there's anything wrong with her or that you can't have good sex. It's just people have preferences. And failures will occur even in completely 100% healthy people. Men can still have erectile disorder. Women can still not have an orgasm. Men cannot have an orgasm. So you could not be interested in sex just for a day. It doesn't mean there's something wrong, or that there's something wrong with you, or there's something wrong with your partner. It's normal. But what's important is how you deal with it. Okay. So anyhow, I think that's probably a good place to end this. There's a few things that I didn't really go over, but selecting a therapist, I guess just real quick, when you choose a sex therapist, there's a lot of like associations that can provide you with a list and maybe able to tell you which ones have special training in sex therapy. Not everybody has been trained in sex therapy, so you can't just go to any therapist. I mean, you could, but it'd probably be better to find somebody who's been trained in it. Word of mouth referrals are good. Asking about credentials. Doing an interview to determine if they can meet your needs, because even if it's a good therapist, doesn't necessarily mean they match who you are as a person. So I'd always tell people to shop around for a good therapist. If you're uncomfortable, then find another therapist. You should be comfortable with your therapist. They should challenge you. That's a great thing, but that doesn't mean that you're uncomfortable with them. And obviously, hopefully that's obvious. Don't have sex with your therapist. Anyhow. All right. And that does happen, sadly, unfortunately, because people are crazy. Okay. Anyhow, now I'm rambling. So if you have any questions, let me know, and good luck studying.